Hello, everybody, and welcome to Conversations in Aesthetics, podcast from Durham Squared. I'm Gary Goldenberg, your host, and today I'm so excited to have my good friend Dee Anna Glaser. Dee Anna, welcome so much to the podcast.
Oh, thank you for having me. I'm excited to be here with you and all of your listeners.
I appreciate it. So, as you know, we're going to start off asking a few questions about your practice and your thoughts of aesthetic medicine, aesthetic dermatology. And then I know you brought some videos to show our audience about a procedure that you're particularly passionate about. So we're looking forward to having a really nice conversation. So welcome and thanks again. I'm going to start off with a question for you. And this is sort of like a holistic question about your practice and sort of the way you view aesthetic medicine. How do you, Dee Anna Glaser, experienced cosmetic dermatologist, define a successful cosmetic procedure for one of your patients? What is your definition?
So, for me, a successful procedure is one that can give the patient improvement that they're looking for, but in a very natural and confident way, and not one that everyone can tell that they've had something done. So I'm definitely more on the subtle side of the aesthetics. And I think sometimes a success is allowing the patient to help direct me about what they really would like to have done. But other times it's really about me explaining to them what's going to give them the final result that they're looking for, even though I may not be doing what they think would be the road or the pathway to the end result.
So it's interesting. There are two things I want to just kind of tease out a little bit more. You know, everyone I talk to, whether here on this format or just general conversation, everyone says, well, it's really important that we give our patients a natural result. And then you look at their work and you're like, oh my God, that does not look anything like a natural result.
Mhm.
Where do you put the brakes on? Do you put the brakes on? Your patients put the brakes on? What do you define? Do you have sort of an ideal in mind when you say this looks natural, this does not look natural?
So I do have an idea, but it's individualized for each patient because of their genetics, their familial background, their age, the things that they do. So I guess I don't have one standard, other than I want them to look um, and feel beautiful, but in a way that others can't tell what exactly has been done. And when I'm asked to do something that I think will not hit that mark, I actually will refer the patient on to someone else who I think can deliver that for them, and just explain that that's not where my thought process takes me. And it's a hard conversation. That's actually the hardest conversation to have.
So I always feel like my aesthetic of what is a good result, excuse me, and the patients have to meet. Do you feel like you have to establish a relationship? Is it something that you do from the first visit? So I'm sort of trending to that aesthetic consultation conversation that I like to talk to guests about. How do you
Yeah.
set the right expectations to make sure that what you can deliver and what the patient wants aligns and they still get a natural result that's beautiful and confident, as you put it?
Yeah, I think the consult's incredibly important, but I do think at each visit and each stage as we move forward in the process, the conversation is equally as important. And I think it took me a few years to realize that. I felt like I had done my consultation, I reviewed all the risk and the benefits and all these things, but I realized that each time I need to have some discussion about what we're going to do, why we're going to do it, what the process will be, how long will they be down, what it'll hopefully look like, and then some of the variances. So I think that consultation in some ways just keeps going with each visit.
So it's really a conversation that you just keep having with the
Mhm.
patient each
Yeah,
time, isn't that right?
yeah. Absolutely. And I give them a chance to express how they felt about the last thing that we did or didn't do. You know, did they like it? What did they like about it? What didn't they like about it? So that I can build upon the successes and keep moving forward in a positive way for them.
I've known you for a long time, and I know you to be an excellent communicator, in any forum, from the podium or in person. And I know you're very passionate specifically about communicating with
Mhm.
patients, and you have a whole sort of strategy and viewpoint on it. I'd love for you to share that with our listeners.
So one of the things that I ask is, I sit down and I never ask how old they are. I don't ask why they're here. I usually start out with, welcome. What would you like to do today? You want to talk about things, or is there anything that you have in mind? Something very open. And I let them lead in instead of saying, what are you interested in and how old are you? And then I listen to them and I try to understand what they're actually trying to achieve. Um, Sometimes they talk about procedures, sometimes they talk about things they don't like. I always ask them after I've listened to them, I ask them for two things that they like about themselves. And it's amazing after 10, 15 minutes of them telling me all the things they want to fix or change and they don't like. It's really challenging for them to name two things that they like about themselves, their face, their whatever. And if they can't find anything, I'll help them out. Like, your eyes are spectacular, or the color of your skin and the smoothness, whatever it is, honestly. I point out some things because we're all so harsh on ourselves. Doctors are, patients are. And it's nice to remember some of the good attributes that we have. And can we build on those? Because it's easier to build on something that's already good than something that is really deflated or really a challenge. And that's the first thing to getting success so that they want to come back and have more opportunities with me.
I have to tell you that's really profound. I'm going to steal that from you. I hope you don't mind, and probably a lot of our listeners are also. But I want to ask you, what are the most common things that people tell you that they like about themselves? And what are some of the most bizarre things that you've heard people say that they like about themselves?
Common things would be one feature, maybe their lips, maybe their eyes, maybe their the clarity of the color of their skin, if they don't have a lot of sunspots or something. Um, some of the more difficult ones are when they talk about things they don't like in very particular situations or particular movements or moods, because I can't control for that. I can't control for the mood. I don't like X when I'm angry, or I don't like, how my smile is when I'm in front of people. And I can't change that basic part of it. So, I just try to redirect them about, well, if you don't like your smile when you're in a group, how do you feel about it when you're, with your family or your friends or loved one? And we try to get down to something where they can agree that it's still good and maybe it could be improved.
My personal favorite is when they bring a photo and they say, in this photo you can see
Mhm.
this little wrinkle right there,
Yeah.
and then you look at their face and it's just it's not there, and you're not sure what to tell them. And I see how it can be very difficult, but I like the idea of building on a positive and kind of building around it,
Yeah.
because we know from human psychology, when people look at your face, the first thing they see is your eyes and then your mouth, your lips. And I think if you can build an aesthetic look around those two features, which I think people usually like about themselves,
Hmm.
I think that's a very positive way of doing it, as opposed to tell me what you don't like about yourself. So I really like that. Deanna, tell me, if you had to do just one cosmetic procedure for the rest of your life, what is that one procedure that you just love doing because you love the results that patients are getting?
Well, I, I won't classify toxins as a procedure. Is that fair?
Okay, fine.
Because I mean, you can get rid of a frown, you can make their, uh, you know, uh, angry lines go away. It's just it works for everybody. You can make such great results, and of course, we all have seen such bad results, right? Where the brows are
Absolutely.
spocked and one's up here and one's down, and they can't move anything. So I think that is, obviously maybe one of my very, very favorites, but it's like children. I can't just have one. So I'm going to go to my next one. And I love to do skin resurfacing because if you can get the quality and the color and the texture of the skin good, then you've got a lot done with just some toxin and some skin changes. I am not as big of a skin care person as maybe other dermatologists. I think it's important, but I want to be in charge and I want to give them what I know I can give them.
So toxin plus resurfacing laser.
Yeah, resurfacing, whatever, chemical peels, microneedling, I used to love full face dermabrasions back in the day before lasers.
Sure.
But if I can make their skin better quickly or slowly, and it's a transformation.
So of those devices, because I like that, I agree the toxins are just, you know, it's universal. I think that's why the muscle relaxant
Mhm.
injections are number one procedure worldwide and the highest
Yeah.
satisfaction procedure worldwide. So I agree with you there. But just focusing on resurfacing
Mhm.
for a second, because I know we're going to show a video of one of the procedures that you
Mhm.
just mentioned. So just walk us through maybe how you explain to patients, okay, we have an option for a chemical peel. You're
Mhm.
going to have this kind of result. It's going to cost you, you don't have to tell us the numbers, but it's going to cost you
Mhm.
less money. You're going to get this kind of result downtime versus maybe something like microneedling or maybe a less invasive laser versus something that's, full surface resurfacing where you get maybe the best result with the most downtime.
Right.
What does that conversation look like for you when you speak to patients about it?
So if I've had the consultation, I know what they do, are they a bike ride, all the things that encompasses their life and what I need to work around. We talk about exactly what you said, results versus downtime, multiple procedures, less downtime, but more procedures, which probably adds up to the same amount of downtime almost, but it's spread out. Um, you know, I ask about, do they have young kids? Do they have young grandkids that they're watching? Like, young kids do not want to see mom or grandma with a bloody face for a week. So, getting to know them really allows you to try to help pick the best result or the best treatment. Um, Melasma and pigmentary disorders comes in big. I definitely choose something without any heat when I know somebody has a lot of dyschromia and pigmentation problems. So that would be, I might go with microneedling even over a fractionated laser or a chemical peel where I know there's going to be some heat and inflammation in there. Um, so again, I think it's being open to really being creative and making sure you are choosing the very best you can choose for that person. And then there's other factors, right? Like some people are in states where only the physician can do a laser, and that may make a difference in what kind of procedure you're choosing. In Missouri, non-physicians can do lasers under our supervision. So that's a little bit easier of a choice for me, especially with some of the milder lasers. But microneedling is fast. It's easy to get done in about a half an hour. I can change how deep I go. If somebody thinks they're going to have 5 days or 4 days downtime and they get here and they're like, I've only got two, I can dial it down and do the same procedure for them, just with less downtime and less results perhaps. But, it's not like I have to cancel a whole hour and a half laser time for them. So there's a lot of things to think about as you're trying to decide. And I've had to go through this process since I left my previous job and, had to think about what do I want to add? What value is that going to give me, my practice, and my patients? So, there's a lot of things to think about.
So what are the trends that you're seeing? Because I know, for example, in my practice, it seems like I'm doing more CO2 than ever because
Yeah.
a lot of patients, have remote work built into their schedule so they can come on Thursday,
Hmm.
work remote Friday, Monday, and then they're back in the office Tuesday, not looking like they have a bloody face, as you mentioned.
Yeah.
So, are you seeing that? Are you seeing more invasive, more ablative procedures? You're still seeing more like lunchtime peels, lunchtime lasers.
No, I think the trend for patients is that they want results. And they know now that you can't have your cake and eat it too. Something's got to give. And so we can talk to them and try to meet their needs as much as we can, but there is a trend that they're willing to have more downtime for better results.
So you're
Definitely.
seeing that in your, because a lot of
Hmm.
it's geographically, you're seeing that in your area as well.
Yeah.
Yeah, I think that's actually a good thing because I'd
Yeah.
rather do CO2 in somebody once
Yeah.
and get the best possible results that they can get as opposed to doing something four, five, six times and not getting there.
I do
Uh,
think the age of the patient and the stage of their life is going to make
of course,
some
of
huge
course.
input. So I have my patients skew more towards the older ages. They've been with me for 30 plus years, many of them. And
You have a mature
so,
practice.
a
You have a
mature
mature
practice.
practice.
I know.
Yes.
Now, if only I would mature along with them, that would be good. But so I think it's different. The few younger people that I have who really are building their careers, who are, got young families, we are still back in the phase of doing more things but less downtime per. Yeah,
I think that's probably very true for most of our
yeah.
practices. Now, you mentioned something that I just want to spend a few minutes on. I know you transitioned from being at university for,
Mhm.
we won't say how many years, for a while, and now you're in
29 years.
29 years. Well, we'll keep
Yeah,
that a secret between the listeners and us. And now you're on your own in private practice.
yeah.
Maybe talk to those that are thinking about going out on their own. Sort of maybe they're in group practice or university practice and they want to
Yeah.
open their own shop. So, what was that transition like for you? Maybe give us some things that you loved about it, maybe some things that you wish could be better.
Yeah, for me, it was a fairly easy transition. I have to say, I was surprised. I just left because the goals of the university were not moving in the way that were going to be productive for me. And I was willing just to quit because I just didn't want to be in that environment doing what they were going to be asking me to do. So I took 6 months off and I realized how much I missed it. I think starting at my stage after 30 years is different because, I've sort of proven to myself who I am and financially I'm not as strapped, with loans and kids and college tuitions and things like that. So I think for me it was a little bit easier and I had a huge cadre of patients. Um, but what I would say to the younger person is that in the long run, I really think it's very satisfying. You can grow with it. You can tell yourself, your patients can tell you what path to go down and how to change and add. I think the struggle for me as a true solo person is like the buying power. I don't have that power of a large group to get the best prices. Um, but boy, when I want to take a day off, I want to, go on vacation. There's a freedom that I had never felt before, and it's been really, really nice. But it is hard work, and so I don't want to make it sound like, you don't have to put the effort in, and especially for people who are starting out, really starting out. And in St. Louis, that's not an uncommon thing still, where one or two individuals will start a practice from scratch. And I think it's wonderful. So everyone has to make their own decision. I worry about those who jump right into a group practice, whether it's private equity owned or other types, where they're promised a big salary and then they can never meet that salary year two and year three, and then they're stuck with a huge non-compete. But it is enticing, and I get it. Many of them are a little disenchanted after the first year. But for some, it works great. It's a job they go to and then they don't worry about anything. So I guess maybe the final advice is do a deep dive into yourself and figure out what's going to make you happy and what your priorities are, and you can change them later. It's the great thing about dermatology. You can do medical and then go into cosmetics. You can do cosmetics and then go into medical or do research. I mean, there's so many things open to us.
It's so interesting you just said that. I remember being a resident with Joe Yuritsa, and he used to always say, you have to have a 5-year plan, but it's okay to change it every year. And I
Yeah.
think it's kind of exactly what you just said.
Yeah.
I think a lot of people start out in one area they may be interested in, and then for whatever reason they decide they want to do something else. And
Yeah.
it's great to have the freedom to do so as a dermatologist. I think we're all very lucky in that way.
And so many people are out there to willing to help us. And there's great resources to look, should I buy a building? Should I just rent? All these kinds of things, these decisions. But there are a lot of people who will help, who've been through it and to ask questions. It's amazing.
100%. I know I got help when I transitioned from academics to private
Mhm.
practice, and I know I've helped some others when they transition, and it's just one of those things that you do for colleagues. It probably goes to the core of our specialty. I think we
Yeah.
have a very nice group of people who are our colleagues, for the most part. I would say 99.9%, but it's really something unique, I think, about medicine and dermatology in particular.
Yeah.
So I want to go to the video. So if Lou can bring up those videos for us, why don't you tell everyone what we're going to be looking at first, then we can run through them, and maybe you can talk
Yeah.
through sort of your thought process, technique, and give some pearls to the listeners who are listening and watching the procedure on their screen.
Yeah, so we're going to start watching some microneedling. And first off, go through the goals and downtime as we were talking about. Because with microneedling, especially, you can do really superficial or you can get down to, good 2.5 millimeters. And if you push a little harder, maybe 2.6, 2.7. So, and what I like about it is you can vary from area to area. And so I think that's really wonderful. I prime the skin as much as I can with retinoids, sunscreens, things like that. And then they come in, they get some topical lidocaine. And depending on how deep we go, I'll use a more concentrated, like a 23/7, or I may use something less heavy and that really won't irritate the skin. And now this person has been numbing for, I don't know, 20, 30 minutes. She's back. We've cleaned off her face. This is her first treatment. And I think she has a wedding of her daughter's wedding coming up. And so you can see that there's three little or four or five little dots, and those are exosomes that we've applied to her skin. And we're going to start moving those around. And we are going to microneedle. And in her forehead, which usually is kind of the most tender area, we sort of get a gauge for how much they're going to tolerate with what we've done. And she's getting it at about zero point 0.5 to 0.75 millimeters. And you can see we're definitely going back and forth, up and down, across. And then we're going to go in little circles so that we don't leave any open spaces because that's very telling when you see a couple of stripes down the skin.
Do you apply exosomes, or you probably can do it with PRP
Mm,
as well? That's probably the first way that all of us did it is with platelet-rich plasma.
yeah.
Um, do you typically apply it after every single cycle of microneedling, or do you just apply it once in the beginning and then just microneedle?
Right now we've been applying it once before and once after. At least when I first started with microneedling, there was a lot of discussion that some of the factors in the blood can kind of get back down through the channels. So we sort of let that organically happen. But I think maybe putting on another layer of PRP or exosomes with each pass wouldn't be a bad idea. And a lot of them you can glide right through it, so it can just be your gliding. I think the key, especially if you're using exosomes, is we don't really know the safety of the injecting them. So definitely use them topically. I think if you're using PRP, you could also augment it by injecting some in some of your problem areas.
Yeah, I love the mesotherapy with PRP after
Yeah,
a procedure, and I sometimes will combine it with the exosomes as well, strictly as a mesotherapy after I'm done with the microneedling. I think that really does give a good result.
yeah.
And do you mind telling us which exosomes you use in this particular patient?
So we use the ones from AMP and
Derive.
yeah,
Derive,
derive, and
sorry,
yeah,
Derive is for hair and it's XOE for the skin.
XOE, yeah, and
That's
then there's
that's
the
those are
repair.
the ones that I use as well.
Yeah.
Yeah,
Yeah,
I
I
think
haven't had any problems with them. I haven't had
same.
any, irritation, allergies, so they've worked very well for us.
And they do
And
glide, the microneedling device does glide very well over the exosome, so it makes a nice surface. So I agree with that.
exactly. And I will say I had my original microneedling pen from whatever the first one that came out 20 some years ago, old, maybe even a little longer. Um, and I did finally try the this particular model that you see in the video, the skin pen, and it has cut down the time of my procedure by about 50%. So I don't know that it gives me any better results, but we're definitely able to get in there, get what we need to do faster. It pushes the needles down and it pulls them back. And I do think that has made it much faster for us. So I
Agree.
did wind up buying it and I'm very happy with it.
Yeah, I use a different brand, but I think having a professional FDA approved microneedling
Yeah,
device is very important if you're going to take
yeah,
it seriously.
yeah.
All right, well, maybe we can get young Lou to bring up the next video for us. We can watch that as well, and maybe you can talk us through it, Deanna.
Yeah. So we're doing the neck now. You can see on her cheeks, we were definitely going deeper. You can see the blood. And again, trying to make sure that we don't have any missed spots. Um, it's I think the neck does very well, and we know that with a lot of lasers, we can get into troubles easily with the neck. It just doesn't heal in the same way without those the pos with the paucity of adnexal structures and hair follicles and things. So, and again, just really getting good coverage and getting to the depth that as deep as we can get to and still get the healing time that the patient needs. And I've had lots of these done on myself. And what I've liked about them is I don't have that same degree of heat built up in my skin after like I have when I've had a laser, whether it's a, fractionated laser or a full ablative laser.
So, will you typically treat the neck the same time you treat someone's face, or is it patient dependent?
I usually try to encourage it. I mean, the neck is aging with us, so I try to get them to do it. Sometimes they can't. But yeah, no, we really try to do that. And that's really even with some of our other like more tightening devices. I'm trying to do face and neck because they are tied together.
Yeah, I think and I agree with you, and I think especially in female patients, the question always is, okay, do you then go down and do the décolleté also? Because
Hmm.
that's, if the face and neck are sun damaged, the V of
Hmm.
the chest is going to be sun damaged as well.
Yeah,
And I think it's always better to have a cohesive look. You want to look better everywhere, not just from here up or neck up.
right. And the same, even if you're doing something like a chemical peel, I'll do a medium depth peel, a lighter peel to the neck, and then a much lighter, and I fan it out onto the décolleté. And it would be the same with microneedling or lasers. I mean, I agree with you. And again, part of that is the discussion, what kind of where, what kind of clothes do you wear? What kind of activities are you doing so that we can really get that done? Yeah.
Yeah, I think that's
And
really important.
as long as we're talking about it, why stop with just a device, right? Sometimes I'll inject a biostimulatory filler at the same time so that I can really try to augment their results as much as possible.
Well, I think this patient that you're showing would be a perfect candidate for something like dilute sculpture or radiesse or
Hmm.
even an HA in
Yeah,
those neck bands.
yeah,
The tech neck kind of a look. I think that's really important because
yeah,
that does age people, and you see that all the time.
yeah.
So I just want to ask you about the depth because we kind of talked about it in passing. So, the video that we showed with the neck, the patient's pretty much, it's a bloody mess. It's a really, it's a bloody procedure. And I've kind of, I used to treat everybody, I would do 1 to 1.5 millimeters on the forehead, 2 to 2.5 on the face, maybe 1.5 on the neck. And now I've kind of backed off since I've been using exosomes because I've noticed that I'm getting a better result with less downtime, better result in PRP, let's say, with just doing maybe 0.5 millimeter or 0.75 millimeters.
Yeah.
Where do you see it in your practice where you really have to go super aggressive or where you can back off and still get a very good result?
Well, I think, the easy one, there's scarring, there's some mild acne scarring. I do think you need to go deeper. The way I present it to the patient is that I think we can use a lighter setting, but we don't know that for sure. Um, you know, and if you have the time for us to go ahead and do a deeper procedure, let's do it. If you don't, I know we're still going to get results for you. But I'm not sure. I haven't quite decided in my mind how much I'm giving up when I'm going much lighter. And the time is the same. So it's really, we have that conversation before each procedure.
So it's interesting because the question always is, are we microneedling to stimulate collagen by
Hmm.
manually destroying it
Hmm.
with a device, or are we simply forming channels for exosomes or PRP to enter through the epidermis into the dermis and stimulate it from that perspective? And I'm with you, I haven't decided. It's
Yeah,
probably a little bit of both,
I think so
don't you
too.
think?
Yeah,
Great.
yeah.
Okay. Let's look at the last video.
And the last one is we're just now starting to reapply. We've cleaned off the blood and we're reapplying exosomes all over. And then we're sending her home with the syringe and some exosomes for home use. Um, and then, it's just please don't use old makeup that your fingers have been in. Please don't use things that, can be contaminated. And Yeah, 10 years ago, I used to make them drive home all bloody. And now we get them cleaned up. And, I still ask them to drive carefully so that they don't get pulled over and taken to the ER thinking something's wrong with them. But it's just a nice procedure. And this whole thing was, 35 minutes. So,
That's great. And when can they apply makeup in your mind? When do those little channels close?
yeah, I think it's safe 24, 48 hours. I mean, I would like them to use something that they haven't had their fingers all over for a long time, if I can. But
So nothing old.
yeah, well,
E-
I'm old, so I don't know. Maybe old's not
Makeup,
so
not
bad.
old makeup.
No, not old makeup. Yeah, used
Um,
makeup.
Use makeup.
Yeah.
It's interesting because there's some studies that show that those channels close very quickly within a matter
Uh-huh.
of minutes, and then there's
Right.
some that show that they can stay open for hours at a time.
Yeah.
So I'm with you. I always tell them just, don't do anything that day. The next morning, wash your
Right.
face, apply sunscreen, and
Yeah.
then lightly, slowly introduce things like makeup, etc.
Right.
So that's excellent. I love that procedure, and I love watching you do it. I think it's a master class on how to do microneedling, and I love the fact that you showed the neck as well. I
Yeah.
think that's really important. So, Deanna, you've practiced for some time. You've kind of seen it all. Where do you see our field specifically of aesthetic medicine going? If you had a crystal ball and you said, okay, in 5 years we're going to be doing this, 10 years we're going to be doing something else. What do you think the future holds for our specialty, especially those of us that focus on aesthetics?
Well, I hope it doesn't get taken away from us by all the non-physician, non-dermatologist, and there are a lot of great people who are doing some of it. But I just met with one of my patients yesterday, and she said, "Yeah, they just have a menu." And I said, "Well, do you select from the menu?" Like, no, you just have to have that menu. And so I think hopefully it's allowing us to use our creativity, our knowledge, our ingenuity to keep staying ahead of what the patients are looking for, right? You know, right now in my practice, they want tighter skin. They want their thighs done. They want their inner arms done. They want the neck done without having to have facelifts at such a young age. So I think we are fortunate to have so many really intelligent people in our field that keep us moving forward with devices and different treatments and, new toxins, new fillers, new combinations. But I guess I I think we're going to start treating people earlier, younger. I think that's already a trend where the
Hmm.
40-year-olds are starting to want something before they really see. They don't want to look like their moms. I mean, how many times have you heard that? I'm starting to look like my mom. And that's never said
Every
in a
day,
good way. I
every
mean,
day.
even when my children say that, it's not in a good way. So I get it. And as soon as they say that, I'm like, well, your mom gave you a lot of good stuff too. Just like got to stick up for
Got to
us as
focus on the
moms.
positive.
But I think that's a good thing. I think people are thinking about it. I don't like the TikTok trends, and I hope those go down. I don't like seeing. I had a grandmother and her two granddaughters in, and they were playing med spa in my office on each other. And it sort of broke my heart a little bit. So I think there's a right time to start, and I'm not saying that there's a particular age, but I do think that's a great trend, and I hope we continue to build on it and find the right procedures for those individuals. I think looking at things that provide results with less downtime and less risk are always being asked of us. Um, I think I don't know where all these drugs are going for the weight loss and how we're going to deal with all of that. Maybe we won't have to after another 5 to 10 years. Maybe we'll be on the right track. But that's a tough one right now for me. People are on them. They've lost that first 10 or 15 pounds. And what can they do? And they've still got 40 more to go. And that's a hard place to be, because whatever I do, they're still going to keep losing volume. And so I struggle with that. I want to provide them some encouragement, but then they're disappointed because it's not lasting as long and looking as good as their next door neighbors or whatever. So I don't know that I have the crystal ball. I hope I'm around to see it and to participate in it. And I'm excited that so many of our dermatology colleagues are willing to offer these things in whatever capacity that they're able to and comfortable with. And I still get referrals from dermatologists who do some aesthetic work. Um, I think one of our big challenges is we're going to have more people of color, of different colors that we're going to have to work with, and we're going to have to find treatments that are really safe in those pigments, because that's still a problem. So I don't
Well,
know.
I think you touched on
Exciting.
everything. I think you really did. I think the GLP, what I see the trends, the GLPs are really driving
Yeah.
aesthetic medicine right now. Whether it's skin tightening or volume replacement, or most of the fat that people lose is visceral fat, whether it's subcutaneous fat reduction in areas where they thought they were going to lose weight but they haven't. It's always, I feel like it's always not what you want. You want to lose weight in some areas and keep it in others, and it invariably ends up being the opposite. So I think there's
Yeah.
definitely some room there, and I do see that being a huge trend in aesthetic medicine. And look, hair loss is so prevalent in patients with on GLPs. So
Yeah.
I think that our work is going to just keep going up, 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 up. And as you, I hope that there's an improvement in technology where we can actually offer help for patients with these complaints without, with safety and less downtime. So I agree with you.
Do you think we'll find a cure or a preventative treatment for hair loss
Well, look,
in
I
the
think
next 10 years?
I think it's very hard to change your genetics.
Hmm.
If you're meant to, if you have that gene for androgenetic alopecia where your hair is sensitive and you get telogen every time you lose 5 pounds, I don't think I don't see changing the genome for those patients.
Okay.
But I do think that the treatments for hair loss are improving. I've
Oh,
been
yeah.
I've been focusing on hair maybe for maybe 13, 14, 15 years now, and I think the treatments have improved, and there's a lot of work to be done still, but I am optimistic. I
Yeah.
definitely am. And I'm
And they
seeing
always
more
say, oh,
women. I'm
it just,
seeing more and more women with hair loss. Like I used to almost never see women.
yeah.
Now the past 10 years, it's probably 75% of my practice is, for hair loss is women,
Yeah.
which we used to never see.
Right.
It's quite disconcerting.
And that's who I'm seeing. And, it's nice to be able to offer a variety of things, whether it's the simple supplements and vitamins to hopefully keep things, steady and moving forward with other kinds of things. I mean, it's really it's fun.
Agreed. Agreed. Well, it's been a real pleasure. Thank you so much for taking the time and being with us for the past 45 minutes or so. And we'd love to have you back at some point if you got some more pearls to
I'd
offer
always
us. So thank you so much, Deanna, for being here, and thank you to all of you for listening and watching. Thank you so
thank
much.
you, Gary. Thanks. Bye, everyone.
Thanks. Bye bye.